in our Master's in Public Health program, but I also teach in our College of Arts and Sciences. I teach a class on risk communication to our Master's in Professional Communication students too. So thanks very much for joining us today. We have about an hour scheduled, and I'm going to keep it a little bit informal today. So if you have questions as I'm talking, then you're welcome to go ahead and unmute yourself and speak up. You're also welcome to put them in the chat box, and my colleagues Carolina Cavaria and Carolina Arroyo are monitoring that chat box. And so we have a couple of different ways to communicate or ask questions at any point. So I'm going to talk about our Master's in Public Health program just a little bit. I'm going to focus on behavioral health. I'm going to talk about what you would gain from doing your MPH here at University of San Francisco. And then I'm also going to weave in some of my own research and my own projects just to give you a little bit more of a sense of what your faculty would be like if you were to join our program. I'm also going to talk a little bit about the COVID-19 pandemic in terms of how the Master's in Public Health with that behavioral health focus provides training for a skilled and effective pandemic response, and also what the COVID-19 pandemic is meaning to our USF community. So again, thank you for joining us today. All right, so USF, we're a mission-driven Jesuit school. So for centuries, Jesuits have advanced academic excellence in the service of humankind, educating students of all cultures, beliefs, capabilities, and inspiring them to strive for justice. Here at the University of San Francisco, what that means for us is that we train health professionals to be excellent practitioners and skilled professionals within the context of certain fundamental values. Throughout our curriculum, we challenge students to consider issues of diversity and social inequities, and then we provide training so that our graduates have the leadership and critical thinking skills to drive change. We're committed to preparing health professionals who promote equity and positively influence healthcare quality, delivery, and access. These values and approaches are fundamental to the University of San Francisco and to our MPH program. You will learn so much about public health in our MPH program because public health challenges are front and center in our local communities within the Bay Area and within the state of California and the larger world. California has many healthy people, and often we're ahead of other communities in terms of progressive public health policies and programs, but we also have many disadvantaged people and communities in our own backyard. So we're often on the forefront of implementing major public health initiatives. California was among the first states to require smog checks for clean air, to pass bike helmet laws, to pass anti-tobacco initiatives, and we passed a statewide tax on sugar-sweetened beverages. And also we're one of the states who's always looking to expand government-subsidized health insurance, and recently we were able to expand this to undocumented young adults. In comparison to most other states, Californians, we eat more fruits and vegetables, we smoke less, we get a decent amount of physical activity, we're pretty good at getting preventive care, at keeping our blood pressure under control. However, we do have tremendous health disparities, which kind of point to two different Californians that vary by income and by race and ethnicity. So for example, when you look at self-reported health among high school graduates versus non-graduates, education being one of our social determinants of health, there's a 38-point difference in people who report being in good or excellent health. So our state in the Bay Area, we have incredible racial ethnic diversity, but we also have tremendous income differences. So we're studying these challenges in real time, and we're working on cutting edge approaches to solving them. This is one of the reasons that I love San Francisco and the Bay Area and teaching MPH students at the University of San Francisco. It is beautiful, it's multicultural, it's exciting, but we need science-based, smart, creative approaches to solving our public health challenges. This is why it's so important that we have our public health students, that we're training our workforce. These are the types of things that you're going to learn in our MPH program. Now, let me tell you just briefly about our MPH program at the University of San Francisco. So we're accredited by CEEF, that stands for the Council on Education and Public Health. We just received our accreditation for 7 years, so that was wonderful news. We offer 3 different concentrations, one in behavioral health, which I'm primarily talking about today, community and public health practice, and also a health policy and leadership concentration. It's a 2-year program. We enroll students every fall, so once a year. We have a really flexible schedule, and students are taking 2 to 3 classes each semester for those 2 years. And you will have classes in the summer, so that's something to know ahead of time too. So it's really 6 semesters of coursework. You also do a fieldwork project, or what we call an applied practice or APEX project. I'll talk about this a little bit later. It's 250 hours of fieldwork alongside a nonprofit or public health community partners. This is one of our kind of hallmarks of our program that is really formative and for students. Our program, our MPH, requires 42 to 45 credits to complete it, and it's designed for working professionals because all of our classes are in the evening. They typically start around 4:45 or 5 p.m., and they're going to go for 2 hours, 3 hours, or about 3.5 hours. So what that means for you in terms of our kind of the way we schedule our classes is that you're going to be in class about 1.5 times a week, all right? And if you have questions about that, then we can definitely talk about that a little bit later. Now, so we have a set of 7 core courses, and every MPH student takes these 7 classes regardless of the concentration. So you are going to take biostatistics in your first semester. You'll take epidemiology in your second semester. Epidemiology is being taught right now, and I will tell you it's a really exciting time to be taking an epidemiology course. You will also take health policy and ethics, health behavior theory and communication in the behavioral health concentration. Students took this last semester, and in the CPHP concentration, they're taking it now. I teach that class. We focus a lot on also on communication that's going on around the pandemic. I just received a note that Lorette can't hear. So can everyone just make sure, can you just let us know, can everyone hear me okay? Okay, so Loretto, if you can maybe text Carolyn Arroyo or Carolina Echevarria, they maybe can help you figure this out. So you're also going to take program planning, management, evaluation. You're going to take global perspectives on public health, and you're going to take a course on leadership and collaboration. And these really meet some of the fundamental competencies of public health professionals. I love the Master's in Public Health degree. It's my favorite terminal master's degree. And I love it so much because students get a standardized set of courses and a standardized set of knowledge and skills. And so it's really great because when you graduate with your MPH, employers know what an MPH degree is, right? Whether that's here in San Francisco, whether that's in our state or country, or even in the world internationally. And so it's really this wonderful degree because you can take this standard set of skills that you're going to learn, you can apply that to any area of health that you want, or if you move outside of health, these skills are totally relevant too. So it's really just this wonderful kind of toolkit that you gain. Now, just briefly, the Community and Public Health Practice Program is offered in every format to our students. The goal of this is to prepare future health professionals to apply public health approaches to promote social justice and address public health issues in a variety of community settings. Your concentration courses for community and public health practice are environmental and occupational health, community-based participatory research and practice, project management and healthcare, and research methods in public health. And then students in this concentration also have a choice of electives. You'll take 2 different electives over the course of your 2 years. We have electives in everything. I teach adolescent health this summer. We have maternal and child health, sexual health, food and nutrition, aging, all kinds of electives. And we're constantly adding new electives based on what's going on in the world and also what our students' interest is. The health policy leadership concentration is based in Sacramento, and we are excited about that offering that program there because, of course, Sacramento is our state capital, so it's really the center of California public health policy. And as I said earlier, California public health policy tends to be on the cutting edge and is often designing and implementing policies that are adopted later by other states in our country. So the focus in this program is on global health policy, leadership, and analysis, and those concentration courses include public health systems leadership, health economics, political and policy analysis, public health strategic planning, health communication, and environmental health. And then third is our behavioral health concentration, which I'll go more into later. But this concentration is available in our San Francisco-based hybrid format. We provide specialized training in behavioral health, health education and promotion, and integrated service delivery for vulnerable populations. Now, what else is exciting about this is that it prepares you to take the nationally recognized Certified Health Education, or CHES exam. And so students are only, or graduates are only available to sit for this exam if you've taken a particular course of study that has addressed fundamental competencies in health education and promotion. So our behavioral health concentration is designed to prepare you to take that CHES exam. So far, we've had very good success with our students on that exam because the competencies for health education and promotion are integrated throughout the curriculum of our MPH Behavioral Health program. So we'll talk more about concentration courses, but you'll take health education and promotion planning and a linked health education and promotion lab, professionalism, health education and promotion, chronic conditions, applied research methods, and integrated behavioral health in primary care. So I want to talk for a couple minutes about behavioral health. So I'm going to give you a quick background there. All right. So first, as shown in the chart on the left, more than half of all premature deaths can be attributed to behavioral patterns in social circumstances. This is a chart for the US, but the entire world is starting to look more and more like that. There's increasing recognition that behavioral health is an essential component of improving healthcare outcomes. And in addition, healthcare industry leaders are now advocating that physical and mental health care needs should be addressed in one setting by an interprofessional team of providers, which includes those who have training in behavioral health and health education and promotion. And we really need to pull our fragmented system together and to address the needs of the whole person. With the advent of the Affordable Care Act, or the ACA, healthcare providers have rushed to integrate mental health and physical health in order to provide holistic and cost-effective care. And of course, now increasingly mental health care is required to be provided by our health insurance providers. Healthy People 2020 also promotes good health for all by attending to physical health, healthy behaviors, and mental health status. So consequently, there's a major opportunity to improve health by supporting patients and populations to engage in health promoting behaviors and by attending to behavioral health needs. The MPH Behavioral Health Concentration embraces this opportunity by training professionals to holistically intervene on health problems through attention to physical, behavioral, and mental health outcomes. Now, in the seminal 1980 paper, psychologist Joseph Matarazzo defined behavioral health as an interdisciplinary field dedicated to promoting a philosophy of health that stresses individual responsibility in the application of behavioral and biomedical science and knowledge and techniques to the maintenance of health and the prevention of illness and dysfunctions by a variety of self-initiated individual or shared activities. Now, this was a seminal definition at the time, but it's pretty narrow, and it really only focuses on individual actions in their health and well-being and not enough on those social environmental influences or the social determinants of health. So in recent years, behavioral health policy, practice, and research have expanded to encompass a range of health and healthcare topics, settings, providers, and populations. So to better understand what behavioral health is, I worked with a small team of students, of behavioral health students here at USF to conduct a scoping review of behavioral health articles that are in the published literature. And the goal of our review was to better understand how public health and medical care professionals are using the term behavioral health. So we searched 4 different databases and for articles that had the term behavioral health in the title. We selected a random sample of these, and we coded almost 400 published articles for a variety of high-level characteristics of those articles. And we found that 81% of the articles never provided an explicit definition of behavioral health. And also that authors of these journal articles really did represent interprofessional practice and collaboration. Authors included PhDs, MDs, social workers, nurses, psychologists, and lawyers. And we also found that there are a variety of different health topics and conditions that are considered behavioral health. These include chronic pain, substance abuse, mental health, chronic conditions, health behaviors, behavior problems. You can see in the schema here that our research team developed this schema based on the findings from this review of these 400 behavioral health articles. And kind of this represents how we think that physical health and mental health kind of come together for the term behavioral health. And what we really need to be advocating for is that we apply this holistic perspective to the term behavioral health to best serve and support individuals and communities. Now, in our MPH Behavioral Health program, you're going to be in class with peers who are passionate about these issues that are shown in this schematic. So this is one of the really awesome things about our program. You're going to make connections who will become your friends, your coworkers, and your colleagues for the rest of your life. And it's really a really strong feeling that our students talk about how being able to connect in their graduate training with students who are passionate about the same issues that they can learn with and from, is really a very powerful place to be in your training. Now, this shows what your course pattern would look like in the MPH Behavioral Health program. So if I just look at this, just if we briefly go through it, you start in the fall with biostatistics, and what we try and do every semester is pair kind of a non-behavioral health focused course with one that is more focused on behavioral health. So biostatistics your first semester, along with health behavior theory and communication, and we really focus that on how do we best support people in adopting healthier behaviors. We take a social ecological perspective, so we look at levels from the individual, moving out to families, moving out to workspaces, to community, to clinics, all the way out to the macro level, where we look at influences around gender, around media, around policies. And we look at how all those different levels of the social ecological model influence a person's behavior. In your second semester, you're going to take epidemiology, also leadership and collaboration, which is a highly interactive, kind of a fun class. And then you're going to start the first of your 2-semester sequence of health education and promotion planning. And this class is run in partnership with our on-campus health promotion services. The director of health promotion services teaches this class, and you're working on real issues. You are working on campus, sometimes off campus, designing health education and promotion programs, materials, trainings, workshops. And then in the fall, you'll continue this with the health education promotion lab by implementing some of the work that you did in the spring. In the summer, between your first and second year, you're going to take global perspectives in public health, and also an applied research methods class that has a focus on issues in behavioral health. So it's tailored for you as an MPH behavioral health student. Then the next fall, you take our program planning, management, and evaluation class. This is a fully team-based class. It's what I call a thick class because you learn so much in this class. It's a really great class. You write a grant proposal with a team of 3 to 4 students. You are also going to take your Apex 1. This is going to get you thinking about, working on your field work, which I'll talk about in a few minutes. And then you'll take chronic conditions also in the fall, which really focuses on the experience of chronic conditions, kind of that lived experience, and then also on the strategies to address prevention and management of chronic conditions at all levels of that social ecological model. And then you'll take the health education and promotion lab that continues your work in the spring, where you're implementing health education and promotion. And then in your last spring, you're going to continue with your fieldwork. You'll take a course on health policy and ethics, and then you'll take a concentration class on integrated behavioral health in primary care. This class is taught by a clinical psychologist who works at the VA. He's been working with our behavioral health students for a number of years now. He loves teaching the behavioral health students. And in this class, you're really going to talk about a variety of different issues around how do we best integrate behavioral health care in behavioral health into primary care, and also around how do we formulate strategies for mental health and substance abuse prevention in treatment in community settings. And then finally, in your last summer, you'll do what's called your ILEX, and you'll write, it's a capstone, it's a written product, and that can take a variety of different forms. And then you'll also take your professionalism in health education and promotion class, and we really go through the main competencies that are needed for the Certified Health Education Specialist exam. So I see a question coming in, but I'm going to answer that in a couple of minutes. So thank you for posting that. So this slide shows a little bit more about these concentration courses, and kind of as I spoke about, the first two listed here is the sequence of the health education and promotion courses, where you're really planning. How do you actually design? How do you actually implement? How do you create partnerships? How do you get volunteers? How do you get people to actually come and participate? It's one of our hardest issues in our public health programs, actually. And then in a second class, you're actually going to deliver those plans. You're going to learn about motivational interviewing. You'll be working with students one-on-one and in small groups. You're going to learn about health coaching, practice peer education, talk about mindfulness, write some social media messages. And then that chronic conditions class, as I said, really that lived experience of chronic conditions within all levels of the social ecological model. And then our integrated behavioral health class, so focusing on mental health, substance abuse, really community-based settings for offering behavioral health wraparound interprofessional services. And then finally, research methods in behavioral health, where we will practice how do we design good surveys, how do we design good small group discussions, how do we write a questionnaire or a focus group guide in order to get the information that we need, what are the measures we need to be focusing, what are all the things that we need to be thinking about when we're doing research. Okay, so our, let me next kind of turn a little bit to kind of what does all this mean, right? If you're an MPH behavioral health student. So the COVID-19 pandemic is highlighting many issues that are directly related and addressed in our MPH behavioral health program. And behavioral health students receive very specific knowledge and skills about how to address these issues. So the pandemic, it's highlighting inequities in people's access to information, to healthcare, to services. And what we're learning from data is that it's disproportionately affecting people with chronic health conditions, older adults, and people of color. So in this pandemic, we need to do a number of things. We need to work to improve living conditions and housing for homeless or marginally housed people. And we also need to ensure that food insecure households are able to access healthy and sufficient food for their family. We have students who are working on these behavioral health students in their fieldwork settings. These are also some of those social determinants of health that your zip code where you live has a big impact on your ability to access healthy food, to purchase healthy food, to live in safe conditions, to have access to clean water, to good hygiene facilities. These are some of those social determinants of health that are really being highlighted right now in the pandemic, that we have these severe inequities. Also in the pandemic, we need to be paying special attention to people who are socially isolated in their homes or experiencing poor mental health due to sheltering in place and other pandemic impacts. We talk a lot about mental health within our program. We also need to provide engaging, motivational, culturally tailored education and messages about how to keep safe And we need to ensure that we have community-based, culturally sensitive, bilingual screeners, testers, contact tracers, and monitors for mitigating COVID-19 transmission. So these are all things that you're going to learn specifically how to work on these, how to design programs so that they are culturally competent, so that they are working on social justice, so that they are paying attention to the most vulnerable, to the most marginalized communities. And then finally, we need to be working with a variety of experts and interprofessional teams to support community and health and wellness during the course of the pandemic. You're going to learn how to do each of these things in the MPH program, and particularly in the behavioral health concentration. So I see this question: as a behavioral health specialist, how is mental health and social health addressed in the community? How do we educate and measure people's growth in those areas? And these are super questions. And I will tell you that one of the really wonderful things about behavioral health, as I showed in that schematic earlier, it really is focused on the whole person, the whole person care, attention to the whole person. It's a Jesuit value, but it's also a public health value, right? And so behavioral health is right there. In behavioral health, we say you can't just pay attention to people's physical health. You can't just pay attention to people's mental health. You can't just pay attention to people's social health. We have to be thinking about health so holistically, because each area of a person's health and well-being affects the other, right? And so that's really that runs through our MPH behavioral health program. So that second question, how do we educate and measure people's growth in those areas? Super question. This is something that in our research methods class, we talk a lot about, right? What are those indicators that we're looking for within behavioral health? So it's an excellent question, and something you'll learn a lot about in our program. Now, throughout the COVID-19 pandemic, we've been keeping our attention focused on supporting our USF community of students, staff, and faculty in the ways that they need it most. So USF, our community, has received $3.6 million in federal aid. This money right now, as we speak, is being dispersed to more than 3,000 USF students to help meet their emergency needs. And we've also established a COVID-19 emergency response fund that will provide emergency financial support to students who are not eligible for financial aid, such as undocumented or DACA students. We've also have a new program that provides laptop computers to degree-seeking USF students who don't have funds to purchase one at no cost to the student. So this is just a couple of the ways that our university is stepping up to really support students and their families during the pandemic. Now, to ensure that our MPH students are able to complete their fieldwork on time and for August graduation, our faculty, and especially our dedicated, incredibly hardworking fieldwork coordinator, have been working really hard to provide additional support and fieldwork opportunities and activities for students. To this end, we've created a special fieldwork policy that we've created in response to the pandemic to maintain our CEF accreditation, our Council on Public Health accreditation, while giving students that flexibility that they need to maximize their learning, and also so that they can graduate on time. The picture here is just a screenshot of a Zoom meeting from my behavioral health fieldwork class. And what's really nice is that each of the 11 students in this class should be able to graduate on time. We're really excited about that. And as you can imagine, they're really excited about that. So faculty at USF were provided immediate support in the middle of March when we quickly transitioned to remote learning. And the university established at that time, and continues to keep updated, a packet of resources for faculty to provide high quality instructional continuity to students. And this summer, all faculty are invited to participate in an 8-hour course for remote course design and maximizing student engagement. Now, in the MPH program, we're really fortunate because we teach in a hybrid format. So that means we alternate our in-person, our live sessions with online student-driven activities in alternating weeks, right? So moving to a fully remote learning format, it's pretty straightforward for the MPH faculty and really the MPH students. And what we're really finding is that our students and faculty are pretty comfortable in this remote learning format. And it's great because it means that we can make sure that we're ensuring that same degree of excellence in our teaching and in students' learning, regardless of the way of our teaching modality or our delivery format. So, and just a quick little note, we've just actually launched a survey of our MPH students because we want to understand more about how the pandemic is affecting them and their families. And one of the things that we're learning, or that students are saying, is across the board, they're saying how much support they're receiving from their faculty and the full USF community, and how much this means to them and how important this is. So I think overall we're doing a really good job of supporting our community and all stepping up to help each other during these pandemic times. I see this note for the question, which I'll answer in just a minute. So our USF community at large has really shown care, compassion, and support in so many different ways during the COVID-19 pandemic. So here's just a few things I wanted to highlight for y'all. In March, as needs for PPE or personal protection equipment were becoming apparent, our campus very quickly moved into action and donated all kinds of supplies. So from our School of Nursing and Health Professions, we donated PPE supplies to St. Mary's Medical Center, which is just down the street from our campus. Our College of Arts and Sciences donated PPE from their labs to the University of California, San Francisco Medical Center to support healthcare workers caring for COVID-19 patients. Even our Department of Public Safety had surgical masks, and we donated those to Kaiser hospitals. These were masks that public safety has on hand as needed for during times when we might have wildfires. Now, this is a quote that's from one of our first year MPH students. You can read that as I'm speaking, but I think that's a really nice quote that really kind of shows how our general community feels about us all coming together and providing just a very high level of support. And that's one thing about our community. It's pretty amazing. It's a very tight community. You know, we have small class sizes, faculty are highly responsive and available to students. Our staff go above and beyond, and you feel this as a USF student. We really have this incredible community. I feel very fortunate to work here. This last picture has gone viral. It shows one of our USF alumni being walked down the aisle by her father in our beautiful St. Ignatius Church. This was just, I think, last week or the week before, and parishioners lined the pews with pictures. So it was really amazing. And then there was a live stream so that family and friends from around the world could watch the wedding via live stream. And the ceremony was performed by one of our campus community, Father Donald Godfrey, who is our Associate Director for Faculty and Staff Spirituality. So this was pretty cool. All right, so to talk for a minute about this fieldwork or the APEX experience, right? So like I said, this is really formative for students. It's one of the hallmarks of our program. Many students are given job offers after they work with a local public behavioral health agency. So you'll complete 250 hours. You'll do this in your second year, started in the fall of your second year and continue through the spring. And it culminates in a professional quality capstone paper, or what we call the ILEX project, as well as a presentation that you give publicly. And students work very closely with your faculty advisor. Every student is assigned a faculty advisor when they start our program in August. You'll work closely with our fieldwork coordinator, and we will help you figure out what type of fieldwork setting you might want to work on. If you have specific populations you want to learn more about, if there are specific health topics, maybe you want to learn more about research, all kinds of different things. And you'll talk about this with your faculty advisor and the fieldwork coordinator. And we will help you find that match that's based on your experience, interest, and your career goals. So what do students do for their fieldwork? So here's a couple of examples from the behavioral health students, right? And as you can see, these projects take many different directions, and they're very powerful. There's such amazing learning opportunities for our students to practice and refine the skills that they have studied in the classroom. They also help students learn to be members of interprofessional teams and work in team environments within organizations, learn how to navigate those behavioral health teams, those interprofessional teams, public health teams, really having support from your peers as well as your faculty. Fieldwork placements are done at schools, they're done in healthcare settings, social service agencies throughout our Bay Area community and often beyond. We've had several students who have worked with the World Health Organization. I connected a student with the Population Health Council in Ethiopia 2 years ago. I have a student right now who is working with a group based out of Philadelphia. So here you can see some of the sample placement agencies. I think we have more than 100 different agencies that our students have worked with since we started our MPH program in about 2013. And so we maintain this list so that it's always available to students, but sometimes students have something different in mind, and we support that too. And we will give you the tools and the support you need to connect with whatever agency you're interested in working with. Now, because our students learn a broad practical skill set, they're prepared to work in a variety of settings and in a variety of roles. These are some of just the titles and the settings that our recent MPH behavioral health graduates are working in. And you can see it runs the gamut of government rates, different populations, different settings. Some of these are startup companies that got bigger, for example. Several of them are in technology-based positions. And we also have students who really go on for doctoral level training. This is one of our students who is doing her doctorate of clinical psychology in New York. We have students who do their doctorate of behavioral health. We have one who's applying for that program right now in Arizona. So really a variety of different roles they take on. Now, I was asked, what would you say your biggest achievement as a health behavior scientist has been in your career so far? And thank you. That's a really wonderful question and a fun question for me to answer. So this is my biggest achievement. It's training the next generation of public and behavioral health practitioners, scientists, researchers, community advocates, behavioral health providers. I really love being a professor. I love being a professor specifically at University of San Francisco, specifically in the Bay Area, because our students who are admitted to our program and who choose to pursue their graduate education with us are inspiring, they're passionate, caring, diverse, they're very community focused. And so our small class sizes are highly available, our caring professors, our responsive staff. We're here to help you with everything. And as I said, at USF, we really care for the whole person, and we kind of do whole person mentoring, right? So it's not just about your academics, right? We're gonna, as you're comfortable, talk with you about everything else that's going on in your life if you want that type of mentoring or coaching. And we really challenge you to be your best self and to seek out the change that you wish to see. But I'm also incredibly pleased about some of the work that I've been doing in the area of mHealth, or mobile phones for health promotion. I was also asked, what's it like working internationally as a health scientist? So I thought I'd just talk about this program for just a brief minute. I've been working on global health promotion and behavior change my entire 25 years in my career. Since about 2007, I've been working on this program called Mobile for Reproductive Health. And you can see it up here. It was launched in 2009 in Kenya and Tanzania. It's been scaled and adapted and expanded to other countries. Those 3.6 million hits, 400,000 unique users, those are old. The government of Tanzania has now adopted our program. The World Health Organization is supporting it and scaling it all over the world. It's very cool. It's exciting. And we really focus on messaging. I'm a health behavior scientist. I have expertise in health communication. And so this is something that I'm able to a way that I'm able to support our colleagues. And on kind of this note, one of the reasons I feel just amazed by this work is that this was, we collected text message data collection from people who were using this M4H platform in Tanzania. And one of my colleagues did a GIS, Geographical Information Systems analyses. We asked people for the region that they lived in, and then we mapped it, and we had this amazing result. We found that 127 out of 129 districts in Tanzania were using our mobile phone SMS program. And so the reach of these types of communications is really extraordinary. And we don't necessarily expect that, but we absolutely have data confirming it. And so we really, this is so exciting, because in resource poor settings like Tanzania, like many countries in sub-Saharan Africa, people don't have good access to information. And so they can now use their phone to get all kinds of information. I love working internationally. I love people. I love getting to know different cultures and how people in different contexts and countries work and function. As a health behavior scientist, I have a lot of knowledge and support that I can provide to in-country or international teams and colleagues, but always at the service of my international colleagues, right? Or of our local partners. This is something we talk a lot about in the MPH Behavioral Health program, that as public health professionals, we partner with people and communities, and we always have a tremendous amount of respect for the assets and the gifts of everyone in our communities. Now, let me share just briefly about a new project. I received a small grant from the USF Jesuit Foundation to develop and pilot this project that's called Examine Your Health, Examen tu Salud, over the next year. And the goal of this project is to bring the daily Ignatian examen to students to strengthen their physical, mental, and spiritual health. It uses the structure of a brief daily reflective exercise that's grounded in Ignatian pedagogy and approaches in order to motivate better health and wellness through a focus on spirituality, self-care, and stress management. And here you can see some of these reflective questions that we're starting to work with, as well as some of the messages. So starting this summer, I'll be working with our MPH behavioral health students on developing the structure, the messaging. Then we'll create probably digital materials, a series of text messages, guiding questions, a coaching guide. We'll pilot this in the fall with about 15 Latino students at USF. Over about a month, and the MPH students will provide weekly coaching support to those pilot participants, and then we'll evaluate this to assess its impact on how students feel about wellness, their stress management, spirituality, health, relationships, social action, all these different things that are really what we focus on in behavioral health. I'm going to answer these questions coming in just 1 second. Let me just conclude with the application requirements. We really take this holistic approach when reviewing our applications. You do need to have a bachelor's degree. Our students come into the MPH program with a variety of different degrees. We love it because it makes our conversations rich. We recommend that you have a GPA of 3.0 or above. If you don't, you should absolutely still apply, because we definitely take students who have GPAs below 3.0. But what I recommend to applicants is that you address that in your statement. So you say, either, you had family challenges going on, and you don't have to go into details, but, you had family challenges going on, or it took a while for you to adjust to college, or maybe your grades in your major were higher, right? So just kind of address it head on if you do have a lower GPA, but by all means, you should still apply. You need 2 letters of recommendation, a professional resume, and respond to our statement about professional goals. You'll also need to submit unofficial transcripts from all post-secondary schools and complete that online application. It only takes a couple of minutes. There is a $55 application fee, but it's waived for all of you today. So you'll receive an email from Carolyn Arroyo that gives you the waiver for that fee. How much time should you spend addressing your GPA in the personal statement? It's like a paragraph, right? A couple of sentences. It doesn't have to be particularly long, right? But it helps us to know or to get a better sense as we're looking at your full packet of materials and particularly your transcript. So just a couple of sentences, really. Okay. And then these are, I'm just going to leave this up here. You are always welcome to contact me if you have questions about, is this the right degree for you? Is this the right program for you? I love mentoring students. You know, as I've said, I love our behavioral health students. I really, it's a powerful experience for our students being in this program. I've been at USF for 5 years, and our students are amazing and universally happy that they decided to do this program. So you can contact me for kind of more program or content questions. You can contact our Office of Admissions at that health@usfca.edu, or Carolyn Arroyo, who's our Director of Graduate Enrollment, Assistant Director of Graduate Enrollment Management, and also Diversity Outreach. So let me just go back to a couple of these questions. Let's see, the biggest differences that I've seen between the behavioral health and community and public health practice concentrations is that community and public health practice focuses more on program management and evaluation at a manager or director level. Will the behavioral health concentration prepare students for the same? So that's actually a great question. So there is an additional class in the community and public health practice concentration. Students will take a class that's focused specifically on project management. Everyone learns about project management across their classes, but particularly in the program management evaluation, program planning management and evaluation course. You learn how to write a logic model, you learn how to do a budget, you learn how to do formative, process, and evaluative or summative evaluation of programs. So everyone will get that, but we do have a little bit more focus on that within the community and public health practice concentration. Also, because community and public health practice, you're able to take 2 electives. All students can take electives. So even in the behavioral health concentration, and some of our students actually do choose to do that, it's just above the required number of units that you have to complete, right? But those electives are always open to you. And we are finding that students are doing electives regardless of whether they are required to take those or not. And I think that's just a nice thing for everyone to know, because faculty, we teach electives that are specific to our area of expertise. So adolescent health, for example, that's one of my areas of expertise. I've worked with adolescents for years, and so I teach an elective on that in the summertime. Okay, so let's see. So this question about, it's frequently stated San Francisco is one of the healthiest cities in the US. Why is that? And why might it not be? So that's a super question. You know, I think California more recently, or in the past couple decades, has a history of progressivism. We also have a history of acceptance, no matter who you are, whether you're from a different racial or ethnic group, whether you're from you have a different sexual identity, whatever it might be. California has a pretty good kind of welcoming spirit and welcoming heart to it. It's also a wonderful, it's such a beautiful state. It's very, we spend a lot of time outdoors, and we also have generally access to fresh produce. And I lived in North Carolina for 20 years, and coming to California and going into a market was amazing to me. Like, I still enjoy that. Like, I stop sometimes and I look, and I go to the farmer's market. There's so many farmer's markets around here, you know, like within blocks of wherever you live, there's going to be a farmer's market, and it's truly phenomenal. So you actually eat more healthfully, right? With fresher food and food that's better for you. We're outside more. I walk to campus. I walk to my office, right? Every day, and it's hilly, it's up and down. So there's some, you know, I think the California lifestyle, life state, it has a lot to offer. So, but as I said earlier, we definitely have incredible, you know, health inequities and income disparities in our state. And so it is much harder for some people and communities to live here and to live here healthfully. That's unfortunately a growing problem across the US and across the world. And one thing that I wonder is, how will our experience with the pandemic, what are the positive implications it's going to have for how we support our communities? And hopefully it will actually lead to some better policy making that is more supportive of everybody, not just the wealthy, but also those who are the most marginalized and disadvantaged in our community. Okay, so on a personal level, do you have a good suggested reading on adolescent health? So I see who that's from. I will send you an email if that's okay. If that's, yeah, that's a great question. There's a lot of great books on this. When I teach adolescent health this summer, I love it when there are parents in the room who have teens, and it really enriches our discussion. So that's super. And if you were to come to USF, no matter which concentration you did, I would highly recommend you take the adolescent health class. Some of the students, after they take it, they say, oh, that's like the parenting class. And so I'm so practice focused. Like everything that I do is really in order to help people live healthier, to live happier lives, to have just better physical, mental, social health and wellness. And so we really focus on what does all of our research say, and what does it mean for how we parent our teenagers. So Gwen, I'll respond to you offline.
Kelly, there's a question from Tori Thomas.
Okay.
How much time should we spend addressing our GPA in the personal statement, a paragraph, or a few sentences?
So just a few sentences is fine, right? Just give us a sense of why your GPA is a little bit lower than what we would normally, what we normally like to see with our students, right? When we evaluate your application materials, as I said, we do it holistically, and we're primarily looking for two things. We're looking for your interest and passion in public health and or behavioral health, that you know what this is, that you know what you're signing up for, right? Because we offer a specific program, a specific course of study and learning, and certain learning outcomes that we meet for you. And so we want to make sure that you know what this is. If you haven't had much public or behavioral health experience, that's okay, but maybe talk about some volunteer experience that you've been doing, right? Or you can talk about your own or your family's interactions with the healthcare system and why that's motivating you to get your MPH. So we really want to make sure you know what this is, and that we're able to meet your goals. And then the other thing that we really look for is we want to be pretty confident that you're going to succeed in your coursework, right? And so that's why when you're writing your personal statement, if your GPA is a little bit low, then go ahead and talk about why that is, and why you feel like you're actually ready to take on graduate study now. We have very high graduation rates for our students at University of San Francisco as a whole, but also within our MPH program. It's very rare, if ever, that a student does not graduate. And that's one of the things that we can promise you, because because you get to know your faculty and your staff really well. Our classes are small. We're a high touch university. There's a lot of warmth in all of our interactions. And so, because of that, you get incredible support as you're going through the program. And if you happen to be struggling in any of your classes, then we work very closely with you to provide the support that you need in order to master the content, okay?
We have 3 questions. One, is there a general theoretical framework that the MPH-BH program uses, or does each professor and class use something different?
So that's a super question. We teach from the social ecological model, and that's what I described earlier, where I said the individual is at the middle of it. And then it's these circles that come out from there, where it's individuals interact with families, and you interact in your workspaces, and you interact in clinics, and you interact in your churches or mosques or temples. So those interactions are going to influence your behavior. Your children interact with schools. That comes back to influence your own individual behavior and the health of your family. And we keep going out from there all the way out to policy level implications, to how are gender roles, how is stigma and bias influencing you? And so that social ecological model it runs through our program, and also the recognition that social determinants of health have an enormous impact on people's health and well-being. One of the things I say that's specific about behavioral health is that behavioral health, I think of as a bottom-up model. So what does that mean? A lot of public health is a top-down model, right? Where it's kind of a medical model, where it's this kind of still assumption that's still out there to a large extent, that if someone is sick, we need to be treating sickness and illness, and we give them some type of clinical medication or treatment, and then they're going to get better. In behavioral health, we know that's not always the case, because people have to be able to access healthcare. They have to be able to pay for any type of clinical medications. Sometimes, even if they're able to get those meds, they end up not taking them all because they feel better, or they might share them with friends or family member, right? Family members. There's so many issues that go into people's health, and in behavioral health, we really take this very, very holistic approach to people's health and wellness.
Chetnat Nandia, can I be working and be in the MPH program at the same time? Do you recommend we take the GRE prior to applying to the program?
Oh, thank you so much for that question, Jetna. So yes, the large majority of our MPH students are working professionals, okay? Now, here's the thing. We advise you not to work full-time if you can afford to do that, right? But working part-time is what the large majority of our students do. And some of them do work full-time and they're successful in that, right? But it can be a lot balancing those 2 to 3 classes a semester with full-time work. But absolutely, this is why we design our programs so that your classes are going to meet in the evening. Like I said, I think most of them start about 4:45. Right? And so because they're 1.5, which is 1 or 2 days a week for the duration of the program, you absolutely are able to maintain not quite a full-time job, but definitely, you know, part-time work, 20 hours, some work 30 hours, that type of thing. The GRE is not required. You know, if students take it, it certainly doesn't hurt, right? And we'll look at those scores, but because we really take this holistic perspective, it's not going to hurt or help your application too much. So I'd really leave that up to you as the applicant.
And one last question. Oftentimes when I mention behavioral health, people think of health coaches or health educators as the only occupation for these studies. Can you please expand on some different occupations that would benefit from having a background on behavioral health?
Oh, that's a super question. Yes, so that's when I talked about the scoping review that I did with a team of behavioral health students, and we were surprised at the findings. We did not expect to see this huge variety in our published literature about what behavioral health means, and so absolutely, people have all kinds of kind of assumptions or impressions of what behavioral health is. So maybe they think it's just a health coach. A lot of people think it's just mental health. A number of people think it's just substance abuse. Some people think it's just your healthy behaviors. It's really all of those things. One of the things that I do with students, I'm doing it with them in just a few weeks, when students are in their second year and they're graduating, we work on them developing a pitch, right? And this is about being able to describe who you are, what your training has been, and the type of job that you might be looking for. And it's really important, we find, for our behavioral health students, because behavioral health is so nebulous and vague, and people have their own impressions of it. And so we really work with our behavioral health students in particular around how are you going to define what behavioral health is and what it means for you. So we work on that. There's so many, I used the thinking about how the pandemic is affecting our community, and there's so many areas within the pandemic where having this training in behavioral health is really, really helpful. So part of it is these community protection measures, for example, right? So we need to maintain physical distancing, mask wearing, good hand hygiene for many months to come, right? And so it can be challenging to get people to adopt a behavior, and particularly mask wearing in the US is strange for us. And then once people get a little more used to it, then getting them to continue maintaining those behaviors is really challenging. So that's an area that within behavioral health we are absolutely going to be talking about all the time, and coming up with practical solutions, looking at theories to help us figure out how to motivate people, looking at what do the content of those communications look like. Maybe there are policies that actually we need to be implementing, or we can implement a little bit differently. Maybe behavioral economics or choice architecture can be used for that. Health education, health promotion. We have students who work as part of care teams, or help with navigation for individual clients, right, who have behavioral health challenges. They might be doing this in a community hospital setting, in a clinic setting. They might be helping we have a student graduate who runs the housing referral program for transitional age youth here in San Francisco. So there's really so many different areas, and the way we define behavioral health is purposefully broad, so that you're going to get that training around kind of community-based prevention for substance abuse, for mental health, but mental health, but also that you're going to get this expertise in help behavior change. So around designing programs, designing education so that it's effective, it's engaging, it's motivating to specific groups of people. So is that all our questions?
Dr. Langle, I think that is, we don't have any other questions coming in, and we're right at the hour, the 1 o'clock hour. So thank you so much. And thanks to everyone for attending today. And as you can see on the screen in front of you, our contact information is right there, but it's been great.
Thank you, everybody.